In a hidden part of Abuja, a group of Nigerians sit around a conference table, papers spread out before them. They are members of the just constituted Health Anti-Corruption Project Advisory Committee, HAPAC. Drawn from some of Nigeria's most seasoned and highly respected health professionals, HAPAC is set out to fight against all forms of corruption in the health sector, bringing transparency, efficiency and accountability.
HAPAC is has membership across very eminent Nigerians, who are interested in strengthening the health system, and then they can get this job done of really making the issue of corruption in the health sector very wide known, and then helping to get a lot of evidence that is generated into policy and practice to help to eliminate corruption in the Nigerian health system. There are many forms of corruption in the health sector. Sometimes absenteeism is a type of corruption when you don't go to work. You don't go to work early, because corruption is defined as when you abuse entrusted power for your private gain. That is corruption. So if you don't go to work, absenteeism, people are going to die. People will receive services. Of course, we know about financial embezzlement, bribery. People paying informally go to a hospital or health center and they charge you what they shouldn't charge you to receive services. We also know about employment-related corruption, where people who are not qualified are employed because they know the godfathers, they know important people, and people who are qualified are not employed. So there are many types of corruption.
If the frontline health facility doesn't have any materials and facilities to attend to the common man at the grassroots, because the money sent for that has been embezzled, the people who are involved, who are sick, will die. That's the impact. They will die. And so if you calculate the number of lives lost because of this corruption is quite high, as was shown in the presentation we just watched. A lot of people lose their lives because of corruption. What is to get to them doesn't get to them. So they are poor, so they can't afford to go to any private place, private hospitals or so. They depend on the primary health care. And if the primary health care is not providing what they should provide to them because of corruption, then there's a problem.
The emergence of HAPAC on the health scene is significant. Indeed, their presence coincides with the new position of Nigeria's coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, who has commenced a massive reform program centered on renewed infrastructure, improved welfare packages, as well as a huge recruitment drive that has seen over 2,000 doctors, midwives, nurses and community health extension workers added to Nigeria's health personnel pool.
If the minister says that and this actually have been done, we'll say kudos to him. But that's just one step out of many steps that need to be taken. After all, there are people in service before. Why are they no longer there? There are reports a particular hospital has lost over 22 consultants, not just general doctors, 22 consultants in a period of 1 or 2 years. Now, a consultant, you need about 10 or 12 years to train a consultant, because you have to spend the medicals. I've been trained as a general doctor for about 6 years. He needs another 4-6 years to train as a consultant who is a specialist. So even if you've made effort to recruit, what effort are you making in order to be able to retain those that you recruited?
One thing we must understand is that at all levels, personnel in health sectors are not optimum in number. They are not enough. If you go to the village, you see the health center, you go in there, maybe you find one person just sitting there and is a ward attendant or something. So there aren't enough people there. And that encourages corruption, because the person there would like to do everything that should be done without being trained to do what is being done. So I think one thing that can be done is to is in human resources to employ more people to those positions and insist that they should work there, because a lot of the health workers, when they graduate from College of Health Tech or nursing schools, they want to be posted to the cities. They don't want to go to the rural areas. And in the rural areas is where you have 80% of your population. So who will take care of the rural areas? So you go to a general hospital, you find so many people there doing the same job. Whereas in the rural areas, you don't have enough of them. So there has to be some way of making it compulsory for them. Community health extension workers are supposed to be in the communities.
The press and especially civil society, they have a big role to play. And also the governance at the level of whoever is giving out the funds for procurement should make sure there's a good accountability mechanism. But that will involve the media and CSOs for the monitoring. During COVID-19, they even set up platforms and all that they were not working. You know, they switched off. I'm sure they switched off those platforms that they can track procurement. If you go to primary healthcare centers, you see a lot of qualified people who are not employed. They are working there as volunteers, paid nonsense. So people are living, but there's still unemployment even within the environment. They say doctors are leaving. Still go, you see so many doctors who are still not employed. So there has to be a very quick way of getting these unemployed qualified health workers into the system. When you go to private, you see, if you go to health center, just go to one. Maybe they have 5 people who are fully employed. You have about 20 volunteers, community health extension workers, and all that. So there's still unemployment even within the HAPAC. You go, you see young doctors. I think it's getting less now. They want to do internship. Other health workers that do internship, they can't find way to do internship. Maybe they wait 1 or 2 years before they get internship. Where to go for internship? So there's still issues that can be solved within the system, and some bigger problems outside the system.
HAPAC is expected to ensure that all forms of corruption in Nigeria's health sector are eradicated, thereby ensuring Nigerians across board are given premium quality health services at all times.